I'm Dr. Nancy Johnson. I'm hired on as a veterinarian here at Horse Plus, and my goal here is to help the animals that Horse Plus takes in, mainly focus on equine, but also anything else that kind of comes along. Went to Virginia, Maryland Regional College of Veterinary Medicine at Virginia Tech. Had done my undergrad there as well. And I grew up on a farm, so my job was always taking care of the sick animals, the lambs, things like that. So it just kind of came naturally along the way. Experience in about any farm animal there is. My main focus, if I'm doing veterinary work, I love the horse work more, followed by my cattle work. And then I love cats and dogs as pets. Not so much for the veterinary side, but you know, it's just the way it is. I was looking for a change of pace, and I really enjoy equine work. The opportunity of a lifetime with this position came along, and I decided to pursue it. I actually found out about Horse Plus through another veterinarian, Dr. Young, who was working here, and she kind of told me about the position, that they were looking to hire somebody full-time. And after talking with her, we set up a working interview and came down and enjoyed it, so I decided to come back. My expectations while working here is mainly to do as much good as I can for the benefit of the animals. My favorite animal, oh, that's a tough one, because I love all animals. I'm one of those people, I love them all, but as I said, mainly for vet work would be equines. That's my passion. Okay, so this morning we're going to take a closer look at Odin. This is going to be, I checked him out when I arrived on Monday, but we're going to do a really more in-depth, just kind of look at his eye. He did come in from auction. His eye was already ruptured. It's a chronic old injury because you can tell by the scar tissue with it. So we're just going to take another look today. We do have him scheduled on Monday for removal of the tissues that are left, because he does have some drainage out of his eye because he still has his tear gland in there. So Dr. Lydia and I are going to tag team with Odin and get that removed, get that his eye sutured up where it's more cosmetically, and plus also not draining with the extra tissue left behind from the scarring. Everything's just kind of retracted back in with his eyelids and everything, especially where his globe is missing on that. Definitely a lot of scar tissue there to dig out, sweetheart. So for Odin this morning, when we took another look at him in preparation for our surgeries on Monday, definitely removal of the scar tissue of what's left in his orbit of his eye. It's kind of hard to tell really where everything's so mangled looking in there, what is actually what. So that's going to make surgery a little interesting, but that's why Dr. Lydia and I are going to tag team, so that way we have a second set of eyes as we remove that, and that will eliminate the chronic drainage he's currently having from that situation as well. He also has a mass on the back of his elbow there, and we're going to take a look at it, do some cytology, and based on how he does with the eye removal, we may decide to remove that mass the same day, depending on cytology, how he does under anesthesia. So we'll get a little further game plan on that one. The eye is the biggest priority. That's his biggest focus, and then the other mass we will add in along the way. He's like, I want to go outside. Okay, baby doll, I will see you again officially on Monday. Okay, so we're getting ready to bring Odin in for his enucleation of what's left of the globe of his eye and the tissues within the orbit itself. And to do that, we are going to do some nerve blocks for pain management. Along the way, he is going to be sedated IV, but this is a little extra. So we've got 3 different blocks. These block the motor function of the eyelids and the pain sensation of the eyelid. This one, the little angle here, is actually going to be for the optic nerve, because the optic nerve has a cardiac reflex that if you pull on it really hard, you can stop the heart. So that's why we want to make, and we'll also do a good 4-point block in here, because where everything is so mangled in there, I want to make certain we have good pain control, anesthesia of the ocular nerve just for that reason. So we're going to do that, and then with his IV sedation, we're going to go in and literally we'll see what all we find in there, because I know nothing looks normal, nothing is feeling normal. So our goal today is to go in and remove all that is left in that orbit so there's not constant drainage, things like that. And then we will suture his eyelids together to hold that closed so it can heal in and hopefully be happy, healthy quality of life then. So I was going to ask you, which blocks did you do last time?
I did retrobulbar.
Okay.
So I just did behind, and then I just did a local ring block around here. I didn't find this fossa.
Okay.
So I probably did like 10 all the way around. And then we had a teeny tiny bit of movement on the lower lid, so I ended up doing it a little bleb down here. But
I think today I'm going to try, where it's a mangled mess in there, is maybe try the approach from behind for the Peterson.
yeah, do it.
I'm going to try it because, again, we don't have to worry about him losing vision because he's not going to be visual. So I'm probably going to, the retrobulbar, since there's no globe, at least do a good 4-point in there.
Yeah.
And then try this one as a backup for
I love it.
So
I love it.
So.
We're going through this door right here. You see it? Good boy. Good boy. It in here? Good boy. Good boy.
You can feel the one little fossa right here, so you can feel that one.
Yep.
And then I'm going to go up here for this one, and then I think about right there for the ocular.
Love it.
So we'll try it again. That's my biggest worry is where it's all scar tissue, we don't have a good numb back there. That's my biggest, other than a mangled mess to cut out.
For sure.
Okay, so we just need to get him scrubbed up, clipped up, and we will start, darling. So I'm just giving us a little padding in between there. So that way when he gets really sedated, we don't have a pressure somewhere that's putting too much pressure on a point. So just give us a little extra padding on that. So it's not just directly pushing against his face.
I'm giving him a drug that will help with pain and sedation.
I suspect, based where he's had previous clips over his jugular veins, that this has been worked on somehow before, but I can't really tell you how. It's kind of all, as I call it, a mangled mess. So I suspect he's clipped on both sides of his jugular, that it's had some treatment, but I'm not certain what level of treatment they did and why they started treating it originally either. So, because that's what I was looking for. I was trying to see if I was suspicious. I don't see any obvious places for squamous cell carcinoma, which horses can get on their third eyelid. So I don't see that outright, but we'll look carefully as we remove that, because that's something we need to know about if that's what started it. So
I'm just trying to clean out all of the drainage that he's had, because whenever we go to clip all of this stuff is like very hard and crusty, and it'll just, clog up our clipper blades.
You ready for scrub?
yes, ready for scrub, yes.
So Dr. Nancy is strategically blocking. There's a nerve that runs right here, and you can see here's where the lids are. So we're blocking this nerve. We're going to do some local blocks right over here, and then we're going to do what's called a Peterson block, where we go kind of back behind the eye. So our goal today is that Odin is awake and standing but can't feel anything that we're doing with surgery.
And I'm just going to go ahead and do a line block.
Yeah.
Around here.
So we have a lot of area that we have to work with around this eye, kind of similar to the last enucleation we did here. We're not dealing with normal anatomy. We're dealing with an animal that has a lot of abnormal anatomy because he had a lot of scarring present.
Okay, that has us blocked
Love it.
around, so we can always go back and add if we need to.
Love it.
Okay, so far what we've done, we have done our regular prep, and at this point we have sutured together the eyelids, and we're going to literally cut off the margin. So we're going to cut off the very tip end And that way, when we close it up, it gives us fresh skin, fresh tissue to seal back together with. So okay, sweetheart, let's get a scalpel blade and we will go from there.
So what she is doing is making an incision really close to the edge of the eyelid in order to get the skin to heal really nicely back together. We can't keep the lid margin present. We have to remove the whole lid margin. But we want to make sure we have plenty of skin. Is that a cat? We want to make sure we have plenty of skin to close together because this is a big horse, so that's a big eye socket. So Dr. Nancy's doing a beautiful job making an incision just parallel to those lids. She's going to do it on the bottom and then again on the top, and then they'll connect together so they go all the way around the eye. I think you're going to have plenty to close with.
That's my okay. So
yeah, I love it. Yes.
We're going to go with it.
Yes. We want to go in fat all the way around, like retrobulbar fat, and not puncture through the eye socket itself.
Okay.
This eye smells so bad, even having been on antibiotics. This is a beautiful incision, Dr. Nancy. I love it.
Yeah, it's a mangled mess. I love your team spirit.
It is. It's gorgeous. I love it. What isn't going to feel normal is you don't have the globe there giving you that, like, you're wanting to feel, like, for me, surgically, I'm feeling along that normal anatomy because that anatomy is abnormal. You just aren't getting that resistance. I think what's going to be hardest about this case is because there's no resistance, you don't have that rubric for when are we cutting over into the eye. But it's not the end of the world if we puncture it.
I can feel the buzz.
I love it. Yeah, perfect. So just keep going around and like we'll pull stuff out of your way as you need it.
It's going good so far. We're just giving it a little more sedation where we're topping off on that. But so far everything just pretty much feels like we expected it, not normal. So.
Okay, Dorm is on board.
And that just makes it, you know, a little slower because nothing's normal. You don't have your normal landmarks, so it's kind of a little bit of a fishing expedition at times.
Unlike other soft tissue surgery, you're cutting through like 40 tiny ligaments, not one big one. So you'll continue to feel that like thick adhered feeling the whole way as you go along. Oh yeah, we got this. We got this, team. This tissue right here is easy, bubs, is what that capsule feels like. So feel how there's that little shelf.
Yeah.
So we cut through the shelf somehow.
Okay.
But if we can stay on top of it, we can reconnect it to itself over here. So I think we can just like suture this closed and kind of keep going. So I think if we kind of work around this way and come behind, then we'll just have kind of one weak spot.
Okay.
Clarence, his eye had been ruptured and infected, but nobody else had messed with it. This horse has had,
Clarence is smelling like his either.
Clarence had really stinky breath, but this horse has had somebody else attempt to operate. So Dr. Nancy and I are dealing with a lot of abnormal anatomy secondary to scarring, and that's always really hard. As a surgeon, you always come back to the anatomy. You review the anatomy, you know where things are, you know what to do. But in this case, his eye is so abnormal that we're just dealing with really abnormal anatomy, which is fine. Dr. Nancy and I just discovered that there is an abnormal piece of bone present in the front of Odin's eye that feels like it could be consistent with a fractured orbit. So that would explain why it's been really challenging to get around behind this eye. If he broke his eye socket, basically the bone associated, and then had a lot of scar tissue form down, that would explain why this anatomy is so abnormal. So we're gonna keep on keeping on with the surgery. I'm confident that it will be successful, but this poor horse literally broke his skull associated with this eye. So who knows what actually happened to him. I am dissecting scar tissue around that area of fracture in the front of the eye. This is one of the most anatomically complicated parts of the eye right here in the front. The blood vessels are larger and there's a pretty big nerve bundle. Odin is not responsive at all. His pain control is really great. So we're just progressing through. I don't know if you can hear me breathing heavily. It's more physically challenging than you would think. So next step is to kind of work around here, but we're in really good shape. We just want to kind of stay at this level so that we keep this socket closed. Dr. Nancy is doing an incredible job. We are transecting the ligaments below the eye. The eye is this amazingly complicated anatomical structure with tons and tons and tons of different muscles. Because if you picture how an eye moves, it can do so many things. And so each of those muscles has to be cut separately. Yep.
Okay.
And you just got to go slow and get all of the anatomy. We're pretty close to being 365 degrees around. And that's the point at which we can kind of elevate that tissue and try to clamp behind it. Odin's doing great. We have repeated some of those nerve blocks, but he's doing really, really well for the surgery.
Beautiful.
So poor Odin has a fracture line that probably extends the whole back part of the orbit. So we identified the first abnormal bony fragment kind of in the front of the eye, and now I'm kind of here in the back of the eye. It doesn't feel like a big chunk of bone, it feels like a fracture line. What's great is he's gonna heal up just fine, and without this infected eye in here, he's gonna feel so much more comfortable. So what we're finding, we just got to the very back of the eye, which is where we clamp. And normally the only thing back there around the eye socket is just fat. And what we are finding in Odin is that he has scar tissue really, really, really strongly adhered to the whole back of his eye. So this part is really challenging because we can't see at all. We're back behind his eye. We're going by feel, and where we should be able to just place a clamp and tie it off, we're having to continue cutting to get back there. So he's still doing great. We're gonna get there, but complications happen. So normally back here we just have fat. And in this one, can you look in there for me? Mm-hmm. There we go. Oh yes. Yes. In this one we've got so much scar tissue. So there's some tissue that's prolapsed from above into the orbit that we don't want to injure or include. So normally we'd be placing something right here, but I'm trying to just break down some of that scar tissue with my finger because it's a lot less dangerous than putting that blade in there. Optic nerve bundle, and that we should now be out, but now we're just attached with scar tissue. Here it comes. It's a girl. Gosh. Look at all of this.
Yes.
Mm-hmm. We got Odin's eye successfully out. This was a really crazy and fun case. He had fractures of his orbit and a ton of scar tissue that had adhered where normally we just have soft fat. He had scar tissue that was like suctioning all of that scar tissue down. So glad Dr. Nancy was here today. She has been amazing. It's been really nice to have two surgeons. We've really needed two sets of hands, but it looks great. He hardly lost any blood. He's done great with anesthesia, and we're just gonna clean that socket really thoroughly and then suture him up. It smells so bad. Do you want to smell it? Do you guys want to smell it?
Okay, thank you.
It really gives you the whole experience. So this is kind of like inside out, right? Mm-hmm. But we removed the lid margins and the lashes, and you can see there isn't a normal eyeball present, but there's all of this mass, and where we normally would have had really soft fat in the back of the eye, we just have like all this crazy thick rock. It's almost like rock hard tissue, like super, super hard. You guys, that was so fun. Odin has, did you see this? You should get this on camera. Odin has a large area on the point of his elbow right here. Mm-hmm. And it feels mostly like firm tissue, but it was a little bit fluctuant. This appears to be some mucopurulent discharge. We're gonna stain this and look at it under slides, but I suspect that we'll find some white cells that indicate active infection. So I'm gonna clip this up and open it up so we get all of that infection out of there. I can't confirm that the neutrophils are degenerate because my stain isn't uptaking, but this is consistent with an abscess. I don't see any criteria of malignancy. So Odin has this large area of abnormal tissue buildup here on his elbow. And we looked at the cells present inside. They're consistent with some infection in here. So I'm gonna get as much of this gross debris off as I can and scrub a spot really clean, and then I'm gonna open it to see if we can get that infection that's trapped inside out. Unfortunately, what usually is the inciting cause for these are you have a large, heavy animal at a really poor body condition score. So Odin's gained a lot of weight even just in the couple weeks that Horse Plus has had him, but he probably had so much pressure on that point of elbow at a low body condition, so he didn't have any fat covering that elbow. He was too thin, and so then they can get kind of pressure points. This can happen commonly in big dogs too. I don't see it that often in horses. He might react to this. Look! Yes! I just have to say this is a really good omen for our working relationship. Yes. Do you agree? Look at this.
Oh yes, that was that little bald spot, wasn't it?
Oh my gosh, you guys. This is such a good omen. It's just, this is every veterinarian's dream right here, except for like radiologists and maybe ophthalmologists.
Yeah, you need to see these photos, my daughter will love that.
That was so wonderful. I'm gonna leave this open and I'm gonna flush it heavily. No, it really doesn't smell. Look how amazing that is, you guys. Do you see it?
I am just appreciating the mangledness of it, that there is nothing abnormal, that I could stand here and 100% clearly identify to somebody. I mean, this right here is just scar tissue, which is why, you know, we had to keep anesthetizing with the lidocaine because the blood flow is not the same, the innervation is not the same. So this was just all just one big mess. The best way of saying it, they're just bad juju. Let's put it that way. Yeah, there's nothing I could safely identify anatomically 100%. So let's put it that way, other than its structures within the globe of the eye. So, okay, yeah, there's nothing normal.
There is a duct called the lacrimal duct that goes from the eye to the nose. So even after all of that surgery, that's the most bleeding that we had from that actual back of the eye itself, which is great. Super happy with that.
Okay, so we have finished up with Odin's enucleation today, and we knew it was going to be different with all the scar tissue. It was definitely more different once we got in there. Identified more than likely 2 different fractures, one on the front of the orbit, one on the back side of the orbit, and just a lot of scar tissue. Nothing felt normal along the way, but we did get it removed. He seems comfortable now, and we will keep a good eye on him and let it get healed in, and thankfully, hopefully, with the removal of that nasty little mess, there's no more nasty smelling drainage along the way. And then he also had a little hygroma that had turned into an abscess walled off on the back of his elbow. Got that lanced and taken care of. So a good little TLC workaround all day for him, and he's on tap tomorrow for the farrier. So we're getting him lined out and ready to go.